A man once sat in my office and said something I will never forget. He looked completely healthy, strong build, married for 22 years. He told me, "Doctor, I almost didn't come today because I thought it was nothing." What he believed was nothing had actually been silently damaging his body for months. No severe pain, no dramatic symptoms, no warning that scared him enough to act. Just a few small changes he ignored, a little burning, a strange itch, a tiny rash that disappeared, a feeling that something was slightly off. And by the time he finally came in, the infection had already spread. This is the terrifying part about sexually transmitted diseases that most men never talk about. Some of the most dangerous STDs don't begin with extreme pain or obvious signs. Sometimes they whisper before they destroy. They stay quiet while they slowly damage fertility, sexual function, the prostate, the urinary tract, and even long-term health. Most men think if an STD were serious, they would definitely know. That is one of the biggest mistakes doctors see all the time, because many infections start silently. Some men carry them for months, even years, without realizing it. And during that time, they may unknowingly pass the infection to someone they love. Tonight, I want you to listen carefully, especially if you are over 35, especially if you are divorced, dating again, sexually active, or have ever ignored symptoms because you felt embarrassed or afraid. What I'm about to share could protect your health, your relationship, and possibly your future. And the fifth symptom I'm going to talk about is the one that scares experienced doctors the most, because men almost always dismiss it until serious damage has already begun. One of the most commonly ignored warning signs is unusual discharge. Now, I know many men immediately stop listening when they hear that word because they assume discharge only happens in women. That is completely false. Men can develop discharge from the penis due to infections like gonorrhea or chlamydia, and sometimes the amount is so small that it barely gets noticed. A man may wake up in the morning and see a tiny stain in his underwear. Maybe clear, maybe cloudy, maybe slightly yellowish. He wipes it away and tells himself it's sweat, urine, or just irritation. But what many people don't realize is that discharge is often one of the earliest silent clues that bacteria are already living inside the urinary tract. And this is where things become dangerous. Sometimes the discharge comes and goes. That's what tricks men. They think, well, if it disappeared, it can't be serious. Wrong. Infections do not always behave consistently. Symptoms can fade temporarily while the infection continues spreading internally. I treated a man in his early 40s who ignored a small amount of discharge for nearly 6 months. He told me he felt embarrassed, even searching online about it. By the time he finally came to the clinic, he had developed severe inflammation affecting his reproductive system. His exact words were, "I thought if it was really bad, my body would scream louder." But the body doesn't always scream first. Sometimes it whispers. Another symptom men constantly ignore is burning during urination. Now, yes, burning can happen from dehydration or irritation, but persistent burning, stinging, or discomfort while urinating should never be brushed aside casually. Most men think, maybe I didn't drink enough water, or it'll go away tomorrow. Doctors hear that every single week. The problem is that infections like chlamydia and gonorrhea often begin with mild urinary discomfort. Not unbearable pain, not agony, just enough irritation that men learn to tolerate it. And tolerance becomes dangerous, because once people normalize symptoms, they stop paying attention. I've seen men continue working, traveling, exercising, and living normal lives while an infection silently worsened inside them. Some even avoid testing because they fear the answer more than the disease itself. But avoiding the truth never stops the infection. It only delays treatment. And untreated STDs can lead to chronic pelvic pain, prostate complications, fertility issues, and increased risk of spreading infections to partners. This is why early testing matters so much. Not because doctors want to scare people, but because we've seen what happens when people wait too long. Now let's talk about something many men completely overlook because it doesn't seem sexual at all. Swollen lymph nodes, especially in the groin area. Many sexually transmitted infections can trigger the immune system, causing lymph nodes to swell as the body tries to fight the infection. Sometimes men feel a small lump near the groin. Sometimes it feels tender. Sometimes it doesn't hurt at all. And because there's no dramatic pain, they ignore it. What many people don't realize is that lymph nodes are like alarm systems inside the body. When they enlarge, something may already be happening internally. Doctors see this mistake all the time. A man notices swelling, but keeps delaying care because he feels mostly fine. Then, weeks later, new symptoms appear. The body was trying to warn him early, but he didn't listen. And here's something even more dangerous. Some STDs can cause symptoms outside the genital area entirely. That shocks many people. They think sexually transmitted infections only affect the penis or urinary tract. Not true. Certain infections can cause rashes, mouth sores, throat discomfort, fatigue, or strange skin changes that seem unrelated at first. I remember one patient who came in because of a rash on his torso. He thought it was an allergy. Another doctor had even treated it like eczema initially. But after further testing, it turned out to be syphilis, and this is exactly why silent symptoms become so risky. They disguise themselves as harmless problems. This is where things become dangerous, because the longer infections remain untreated, the greater the chance of long-term complications. Some infections can affect nerves, some can affect joints, some can affect the heart, some can damage reproductive health permanently, and many men have absolutely no idea the danger is growing inside them. Another symptom that often gets ignored is itching or irritation. Now let me be clear, not every itch means an STD, but persistent itching, redness, irritation, or unusual sensitivity around the genital area should never be automatically dismissed. Most men think it's probably sweat, or maybe it's just soap irritation. Sometimes they buy random creams from a pharmacy without understanding what's actually causing the problem. That can delay diagnosis even more. Doctors often see men treating symptoms blindly instead of investigating the root cause. And some infections temporarily improve with creams or home remedies, making men falsely believe the issue is gone. Meanwhile, the infection continues underneath. I've had patients tell me, "Doctor, it stopped itching for a while, so I thought I was cured." But infections don't disappear because symptoms calm down. That false sense of relief is one of the reasons silent STDs spread so easily. Now there's another symptom many men feel too uncomfortable to discuss openly: testicular discomfort. Not necessarily severe pain, sometimes just heaviness, tenderness, mild aching, a strange pulling sensation. And because it isn't extreme, men delay care. This happens constantly, especially in older men who assume aging is responsible for every new discomfort. But certain infections can travel into the reproductive organs and cause inflammation around the testicles. And this is one of the moments where delayed treatment becomes extremely risky, because untreated inflammation can sometimes affect fertility and long-term reproductive health. What many people don't realize is that men often wait until pain becomes unbearable before taking symptoms seriously. But in medicine, waiting for unbearable pain is sometimes the worst possible strategy. The earlier infections are treated, the easier it usually is to prevent complications. Now, I want to talk about the emotional side of this for a moment because this part matters more than people realize. Many men avoid testing not because they feel physically fine, but because they feel ashamed. They fear judgment. They fear embarrassment. They fear hearing bad news. They fear what a partner might think. So instead of facing the possibility early, they convince themselves everything is okay. Doctors see this mistake all the time. And sadly, silence allows infections to spread further, physically and emotionally. I've watched relationships collapse because someone ignored symptoms instead of having an honest conversation early. I've seen men suffer anxiety for months because deep down they suspected something was wrong but kept avoiding answers. And the truth is, uncertainty often causes more suffering than testing itself. Because modern STD testing is straightforward, confidential, and treatable in many cases when caught early. But when infections stay hidden too long, consequences become much harder to reverse. There's another terrifying reality many people never hear enough about. Some STDs increase vulnerability to other infections. When the body's tissues become inflamed or damaged, it may become easier for additional infections to enter the body. That means one ignored symptom can sometimes open the door to much larger health problems later. And unfortunately, some men continue spreading infections unknowingly because they assume no major symptoms means no infection. That assumption has ruined lives. Please understand this clearly. You cannot judge sexual health based only on pain. Some of the most serious infections begin quietly. That's why experienced doctors pay attention to patterns, timing, subtle changes, and symptoms that ordinary people often overlook. Now let me tell you about something especially dangerous that happens in men over 40. Many symptoms get blamed on aging. Burning urination? Probably age. Pelvic discomfort? Probably stress. Reduced sexual performance? Probably testosterone. Fatigue? Probably work. And while sometimes those explanations are true, sometimes an infection is hiding underneath. This is where things become dangerous. Because men become experts at rationalizing symptoms instead of investigating them. And the longer they rationalize, the longer infections remain untreated. I once treated a man who ignored pelvic discomfort and urinary symptoms for almost a year because he thought it was simply getting older. When testing finally revealed the infection, he sat quietly for several minutes before saying, "I wish I had checked sooner." That sentence stays with doctors forever, because we hear it again and again. I wish I had checked sooner. And before we continue, there's one silent symptom that almost nobody talks about enough. It doesn't always hurt. It doesn't always look alarming. Some men don't even realize it's happening until intimacy becomes affected. But when this symptom appears, experienced STD specialists immediately pay attention because it can signal that the infection is already moving deeper into the body. One of the most dangerous silent STD symptoms men ignore is pain or discomfort during intimacy and ejaculation. And I'm telling you right now, this is the symptom many men feel too embarrassed to admit even to themselves. Because when sexual problems begin, most men immediately blame stress, aging, low testosterone, or performance anxiety. Very few stop and think, could this be an infection? But what many people don't realize is that certain sexually transmitted infections can trigger inflammation deep inside the reproductive system. Sometimes the prostate becomes irritated. Sometimes the tubes connected to sperm production become inflamed. Sometimes nearby tissues become infected slowly over time. And the symptoms are not always dramatic. That's what makes this so dangerous. A man may notice ejaculation feels slightly uncomfortable. Maybe there's pressure afterward. Maybe intimacy no longer feels normal. Maybe erections become less reliable because the body is dealing with hidden inflammation and anxiety at the same time. But instead of seeking medical help, many men stay silent. Doctors see this mistake all the time, especially in men over 35 who feel ashamed discussing sexual symptoms. I remember a patient who waited nearly 8 months before speaking honestly about discomfort during sex. He kept telling himself it was stress from work. He changed vitamins. He tried supplements. He even avoided intimacy entirely because he was afraid something felt wrong. And when testing finally revealed the infection, he looked at me and said something heartbreaking. I was more afraid of embarrassment than I was of the disease. That sentence explains why so many silent STDs continue spreading. Fear keeps people quiet, and silence allows damage to continue. Now let's talk about another symptom that shocks many men when they finally learn the truth. Sores, especially painless sores. Most men believe dangerous infections must hurt badly. Not always. Certain STDs can cause small painless ulcers or sores that disappear on their own after a few days or weeks. Because they vanish naturally, men assume the problem healed. But this is where things become extremely dangerous. The disappearance of the sore does not mean the infection disappeared. In some cases, the disease is actually progressing deeper into the body while the visible symptom fades away. That's one of the scariest medical realities about certain sexually transmitted infections. The body may look calmer on the outside, while the infection silently advances internally. And because the sore wasn't painful, many men never get tested. They continue life normally. They continue intimacy normally. They unknowingly expose partners. And months later, new health problems appear that seem completely unrelated. What many people don't realize is that sexually transmitted infections are masters of disguise. They imitate harmless conditions. They come and go. They confuse people. They create false reassurance. That's why experienced doctors never rely only on whether symptoms feel serious enough. Now, I want to address something many viewers may be thinking privately right now. Doctor, what if I had symptoms years ago and ignored them? Listen carefully. Not every ignored symptom leads to permanent damage, and many infections are treatable when identified properly. The goal is not panic. The goal is awareness. Fear without action helps nobody. But awareness can save health, relationships, and peace of mind. This is why testing matters so much. Not because someone is dirty, not because someone should feel ashamed, but because human beings are human. People make mistakes. People trust the wrong partner. People don't always know they were exposed. And many infections spread silently from people who genuinely had no idea they were carrying them. Doctors understand this better than anyone. That's why professional medical care focuses on treatment and prevention, not judgment. Unfortunately, many men avoid clinics because they imagine being criticized or humiliated. But the reality is very different. Most sexual health specialists have seen thousands of cases. Nothing shocks us anymore. What concerns us is delayed treatment, because delays create complications. And some complications can become life-changing. Untreated infections can sometimes lead to chronic inflammation that affects fertility. They can create ongoing pelvic pain. Some infections increase the risk of long-term prostate problems. Others can affect joints, nerves, skin, and even cardiovascular health in rare advanced cases. And then there's the emotional damage. This part gets ignored far too often. I've seen men develop severe anxiety because they kept Googling symptoms secretly every night instead of getting tested. I've seen marriages collapse because someone hid symptoms out of fear. I've seen people lose trust in relationships because silence created suspicion and confusion. And many of these situations could have been prevented with one difficult but honest conversation early on. This is where things become dangerous emotionally, because shame convinces people to hide, and hiding delays solutions. Now, let me tell you another reality many people don't know. Some STDs can remain asymptomatic for long periods. That means a person may have absolutely no obvious signs while still carrying the infection. No pain, no discharge, no rash, nothing dramatic at all. This is why relying only on symptoms is risky. Most men think, if I feel okay, I must be okay. But doctors know that infections don't always announce themselves loudly. That's why regular testing after potential exposure matters even when someone feels perfectly healthy. And for men entering new relationships later in life, this conversation becomes especially important. Many people over 40 re-enter dating after divorce or long relationships ending. They often assume STDs are mainly a concern for younger people. That is completely false. In fact, doctors have seen rising STD rates in older adults partly because many stop worrying about protection once pregnancy is no longer a concern. But infections do not care about age. And unfortunately, older adults sometimes get diagnosed later because symptoms are mistaken for aging, prostate issues, urinary infections, or skin irritation. This is why awareness matters so much. Now, I want to talk briefly about online misinformation because this is becoming a serious problem. Many men try diagnosing themselves through internet forums, social media videos, or random advice from strangers. That can become extremely risky because symptoms overlap. A rash could mean one thing, or 10 different things. Burning urination could be an STD or not. Pelvic discomfort could have several possible causes. This is why proper medical testing matters. Not guessing, not denial, not wishful thinking, real answers. Doctors see men waste months self-treating the wrong condition because they were too afraid to get evaluated professionally. And meanwhile, the real infection continued silently. Now, there's another symptom many men ignore because it feels too minor to matter. Fatigue. Yes, exhaustion. Not every STD causes fatigue, of course, but when the immune system fights infection, some people notice unusual tiredness, body aches, swollen glands, or low energy. The problem is that fatigue is easy to blame on life, work, stress, poor sleep, age. So men rarely connect it to possible infection. What many people don't realize is that the body often gives subtle clues before major symptoms appear, and experienced doctors pay attention to patterns. A person with fatigue, swollen lymph nodes, rash, urinary discomfort, and pelvic irritation together raises concern very differently than one isolated symptom alone. This is why medical evaluation matters more than isolated internet searches. Now, I want to say something directly to the men watching who may currently be ignoring symptoms. If your body feels different, pay attention. Do not wait for unbearable pain. Do not wait for symptoms to become dramatic. Do not assume silence means safety. Some infections stay quiet while damage grows. And one of the biggest tragedies doctors see is men arriving too late because they spent months convincing themselves it's probably nothing. I understand fear, I understand embarrassment, I understand denial, but your health matters more than temporary discomfort, and protecting a partner matters too. Because real strength is not pretending nothing is wrong. Real strength is handling problems early before they become bigger. That's what responsible men do. And remember this carefully. Getting tested does not mean you are weak. It does not mean you are immoral. It does not mean your life is over. It means you are mature enough to protect yourself and the people you care about. Some of the healthiest patients I've ever treated were simply the ones willing to act early instead of hiding. And some of the worst outcomes I've seen happened because people delayed care out of pride or fear. Doctors see this mistake all the time. Now, before I finish, I want every viewer to remember the 5 silent warning signs we discussed: unusual discharge, burning urination, swollen lymph nodes or unexplained rashes, itching, irritation, or sores, and discomfort involving the testicles, pelvis, intimacy, or ejaculation. None of these should automatically create panic, but all of them deserve attention when persistent, unusual, or connected to possible exposure. Because early action changes outcomes, and the most dangerous words many doctors hear are, "I thought it would go away." Sometimes it does, but sometimes that delay changes everything.